Okay, peace and greetings to you all. This is Omar Abdul Malik, otherwise known in some circles as Dr. O, the PA Pro. It is 11:38 p.m. and today is Monday. So happy Labor Day. Uh, I've been here at the hospital along with my colleagues laboring. Let's see, just some thoughts, and I'll be kind of rambling because I made a promise to myself that I would try to do one video every day for the month of September. So what I'll talk about today is, I guess, maybe the concept of labor, since it is Labor Day, and how important it is to try to do what you enjoy doing for money, as long as it's positive. Yeah, being a physician assistant is really been a godsend for me. It's been a little more than 16 years now, 16 years and some months that I've been a licensed physician assistant, and I have enjoyed it quite immensely. Coming to work to me is not like going to a job that I hate. I really, really enjoy what I do. I get to affect people's lives in a positive way, and I get to work with really great colleagues and, be a leader in my field. Having said that, I have not forgotten where I started in the healthcare field, which was being a certified nursing assistant. And as a case in point, I had a very sick patient who was morbidly obese, who had to be moved. He's in incredible amounts of pain, and it takes the nursing assistant a lot of time, or the patient tech, I think this person is actually, a lot of time to move the person, make sure the person gets turned on his side. But she was busy, so I helped the patient, just tried to adjust the patient's body on pillows so the patient could be a bit more comfortable. And I think that's important, because sometimes when you get to a certain level, you may feel that certain jobs are beneath you. So if you become an LPN and you used to pass out trays and clean people off, you're like, I don't do that. You become an RN and you go into RN administration, you may have the temptation to think that it's beneath you to pass out pills. You become a PA, you may think that it's beneath you to do things that maybe an RN would do. Then you become a doctor, you may think it's beneath you to do things that only a PA would do. But we all have to kind of work together. So I spent several minutes with one patient doing the work that I used to do as a CNA many years ago, like more than 25 years ago. But it was rewarding. It helped the patient, and it saved the patient technician, or the CNA. It was a CNA actually. It saved her time, and it was a reminder to me that every little bit that you do for your patient counts. Whether it's just putting your hand on the patient's shoulder, saying, "Look, it's going to be okay. We're going to do the best we can for you." One patient reminded me, a patient I had. He says, "Look, you get to go home. I'm still stuck here in the hospital, and many of the patients that I have got chronic conditions. They're not going to get any better. I've got patients who have got advanced multiple sclerosis. They've got this ALS. The most they can hope for is some bit of dignity. They've been in car accidents. Some have got paraplegia from CVAs, cardiovascular accidents, or strokes. They can't clean themselves off. They can't scratch their nose when it itches. If a fly lands on their face, they can't brush the fly off. They can't even eat in some cases, and they've got to be fed through an NG tube, nasal gastro tube, or a G tube, a gastric tube. So we take a lot of our health for granted. And in some cases, it goes back to taking our jobs for granted. So don't look down on other people, and appreciate what you do, but also appreciate what others do, and appreciate the position that you've been given. I ramble, but that's okay. My excuse is that it's late. I have a lot to talk about, but I'm also very sleepy. I'm also very tired. It's been a long day. 12-hour shifts, back-to-back 12-hour shifts take their toll. So, yeah, keep up the good work for those of you all who are in the healthcare field, and those of you all who are students. I think Kim, the PA, and Adanna the PA, and then I just subscribed to somebody's channel, a young lady who's in PA school now. But you guys are in for quite a fight. But keep doing it. Kaynen Brown, keep doing the nursing program. You're almost done. But it's a great field being a healthcare provider in any capacity. So I wish you all a good night. God bless you. Take care.